Hello, my name is Cheriken, and today I'm going to talk about generalized anxiety disorder. First of all, I'd like to include some of the criteria in the DSM-5 for this disorder. The first criteria is that you have excessive worry or anxiety for more days than not for 6 months. One of the last criteria is that the disturbance is not better described by another disorder, such as OCD or um, social anxiety disorder, and so we want to eliminate all the rest of the diagnoses before we diagnose with generalized anxiety disorder. So most commonly, people go to the doctor and find out that they have generalized anxiety disorder because of sleep disturbances. That's one of the most common symptoms of generalized anxiety disorder. Either they cannot fall asleep or cannot stay asleep. So for generalized anxiety disorder, what age? It can happen with all ages. It usually is. It's not common with children under the age of 9 due to the factor of thinking about thinking. They don't usually have that mental capacity to be able to think about thinking, and with generalized anxiety disorder, you kind of need that because you are constantly worrying about the future and the past and the present as well. So they don't have that capacity usually, but it is seen in children. It's just there's different symptoms that they may have. And it is most common in women, and usually the diagnosis is around the age of 26 is whenever they're usually diagnosed. That's the most common age. So one study from Canada, we're trying to talk about the cost here, the lifetime cost of generalized anxiety disorder. So the lifetime cost of generalized anxiety disorder could mean the financial cost or the social cost. So let's first talk about the financial cost. So like I said, the study in Canada, they showed that $35,000 in a lifetime for people with generalized anxiety disorder. And you must remember that in Canada, most of the healthcare is free. They have visits for free, psychiatric treatments, things like that. And so most people would only have to pay for the prescription, and some of the most common prescriptions for generalized anxiety disorder would be Zoloft or Prozac, and things such as that, Paxil, and most of those run decently low. So for about a month's supply, it'd probably be around $5 to $20. So as you can imagine, it is an expensive disorder. But let's also talk about the social cost. The social cost of anxiety disorder, generalized anxiety disorder, is that people don't have the capacity to go to work like they're supposed to, or go to school. They have anxiety about everything, and it holds them to their place, their comfort place, and so the social cost of that would be they're not able to force themselves into society the way that they need to be successful, the way that they want to be. So of course, the social cost will go down once we learn more about this disorder and more people are able to be treated with that. Some of the treatments, it is recommended that you use pharmaceutical and psychological treatments for generalized anxiety disorder. Like I said, there are drugs for that, and also the psychotherapy would be CBT, which is cognitive behavioral therapy. So you would there would be also group therapy. You would learn problem solving, relaxation techniques through cognitive behavioral therapy. And so the DSM-3 is the first time that it was introduced into the DSM. And so the first person was Edouard Brezand. He was a French physician and pathologist. He actually coined the term generalized anxiety disorder. He realized that is a disorder to itself. It wasn't attached to social anxiety disorder, OCD. It was his own disorder. That was identified in 1899. So as you know, that was a good thing for people in those ages because they needed, help. Okay, so some of the causes. Um, there are brain circuits in the amygdala of your brain, and they're called GABA. Most people say GABA. So that is gamma aminobutyric acid, and it regulates the emotions and physical responses to stimuli that could possibly be a threat. So a lot of people say that is your fight or flight response, and because of that, you might, back in the Stone Ages, we had a fight or flight response. We see a lion or a tiger, and where our whole body gets ready to run. And so some people, they still have this fight or flight whenever we don't need it in the society that we live in today. So you may have heard that fight or flight is one of the causes of generalized anxiety disorder. And so in conclusion here, generalized anxiety disorder, it's a common disorder. It is lifelong. It's very uncommon for somebody to be completely cured of this disorder. It's common to feel anxiety about new situations, but generalized anxiety disorder takes the anxiety past the new situation. So then you see, the anxiety and the stress past the new adventure that you have taken yourself on. Like I said, it affects women more than it affects men. You usually have the ability to think about thinking, to be diagnosed with this disorder, as I said, with children usually under 9 years old. The financial cost can vary on where you live and your social and economic status, but the social cost is nearly constant. But with more education and proper treatment, then that social cost will definitely come down. I have faith in that. So, like I said, the pharmaceutical and psychological treatment are both recommended for this disorder. They want you to get both of these. And the fight or flight response that's linked to generalized anxiety disorder, that's something to look into to try to understand generalized anxiety disorder a little bit more. There's research being done for this disorder and more progress to come. I hope this video has helped you get a general notation of what generalized anxiety disorder is for those individuals suffering from this disorder. And I hope that you have a good day, and thank you so much for watching, and see you next time.